There he is right there. There we are.
Okay,
Awesome.
great.
All right, guys. So, hey, we're going to go live here with Dr. Robert Melillo. Dr. Melillo's, he's the guy, that doctor that I learned all my primitive reflexes, all my childhood development disorders. We now teach together, and he's wrote a book called Disconnected Kids, as well as numerous books. Recently just opened up or just released another book called Einstein's Desk that just came out on Amazon, and it's incredible. So, Dr. Melillo, if you won't, what we'll do here is I'll just ask you a bunch of questions, if you don't mind answering them, and then we'll comment, and I'll look at some of the comments here to get any questions. We'll try to answer as many questions as possible.
I think it's great. I've been, as you know, I work with a lot of families all around the world, and a lot of it is virtual. And I've just been getting inundated with people, with so many questions since now their kids are home, and some of their issues seem to be so magnified. So they're desperate. So they asked me if I would do something like this. So this is really great, Kyle. I'm happy to do it.
Awesome. So let's get first started here, because it's pretty neat. We have a lot of actually followers from all over the world sort of join in here asking questions. So in your opinion, I know you work a lot of kids with sensory disorders, and you talk about brain imbalances, but what is a brain imbalance to you?
Well, most of the time it starts in development. What we see in research in psychology, neurology, education, is that almost everything, even adult issues, really start in early development, maybe even in the womb. So what happens is that there's this developmental imbalance in growth, where really what we see is that certain networks on one side of the brain kind of slow in their growth initially, and these are mostly environmental factors that impact the growth and the expression of genes. They don't damage the brain in any way, and the right side of the brain really develops first in the womb and for the first 3 years. So what happens is that if something slows that development in the first 2 or 3 years of life, usually what we see is that the other side of the brain, the left brain, comes online too early and too strong, especially in people that are naturally gifted in that side of the brain. And what we see is that whole combination of everything is really called a developmental asynchrony, where developmentally one side of the brain is developing faster than the other and at the wrong time. And this sets up an imbalance where one side of the brain kind of matures at an accelerated rate, and the other side of the brain matures at a developmental delayed rate. And so we end up getting areas of the brain that are immature and areas of the brain that are too mature, and they can't really connect or communicate with one another. And this sets up what we call as a functional disconnection. All the research has been around what we call functional connectivity, that everybody recognizes that all these problems like ADHD and autism and dyslexia and OCD and Tourette's are really a product of what we call functional connectivity. And when that doesn't happen, it's what we call a functional disconnection. And that's really been my basis of research over the past 20, 25 years. And so this imbalance is really a maturity developmental imbalance. Well, once it starts at a really minor level, it tends to grow over time. And then what happens is when the brain does shift back, it accelerates even more. So this imbalance tends to get worse over time. It affects the coordination and the communication of different areas of the brain. And what we see is that almost all symptoms of educational and behavioral and mental health issues, and even most physical health issues, are where we see certain areas of the brain are overactive, like when we look at OCD or hyperactivity or impulsivity or tantrums or anger outbursts or manic outbursts. These are overactivity of the left brain. And then we get underdevelopment of the right brain. So we have lack of attention or lack of social skills or lack of empathy or not being able to see the big picture or poor reading comprehension. So that to me is what we look at as a developmental imbalance. And we like to talk simple for people. So it's really a complex thing, but we say brain imbalance because it's an easy way of describing, and it doesn't mean it's an easy thing to understand or to change. But it is a pretty accurate description, I think.
Yeah, that was a pretty solid explanation. So the next thing here, because something that, I've used Instagram a lot and we talk all about is primitive reflexes. And one thing that I find a lot, or I hear a lot of patients tell me is, as a parent, they bring their kid to the doctor. Let's say, for example, the kid's not talking or they're not walking, and the doctor, tells them that their baby's lazy, or that, that just give it some time to wait it out. And, I know you know this answer, but we can just talk about, like, in a situation like that, should primitive reflexes be addressed in routine wellness visits? Is there anything that a parent can do whenever their kid's, not walking or talking?
Yeah, and it's really amazing, Kyle, because for a doctor to say a baby or a young child is lazy, right? What happens is many times we take our adult biases and we project them onto small children. We'll say, they're anxious, or they're being willful, or they're deliberately trying to, be disrespectful. And when you're talking about a 2 or a 3 or 4 or 5-year-old kid that's raised in a good family, that doesn't happen. Projecting psychological issues on kids that are in really good families and that are very young is wrong. What they almost always are neurological issues. They're neurological imbalances, they're underdevelopment, they're overdevelopment. And what we see is that all of our emotions and all of our behaviors ultimately are created in our brain, in specific networks in our brain. And we have areas of our brain that will activate those behaviors or accentuate or increase those behaviors. And we have other areas of our brain that will dampen them or stop them or prevent them from happening or make them so they're not over exaggerated. And if these networks aren't really coordinated and working and synchronized with one another, then we'll see a behavior in a child. But it's always neurological. And that's important, because when you're trying to behaviorally manage a neurological problem, it doesn't work, right? Like if you try to say, a child is going to be oppositional, so we're going to do, it's not that we don't do normal parenting, but normal parenting doesn't work with a child with a neurological imbalance. And so, parents can feel bad about that. But, I've never met a child that's lazy, or that a child that's deliberately, willful. There are children that grow up in horrible situations and have what we call adverse childhood experiences and can be exposed to psychological traumas at a young age. I mean, that does happen. But the majority of people we work with, the parents are heroic, right? These are parents that make sacrifices and fly all over the world to see us and are paying all types of money for us to help their children. These are great families. And so, most of the time, I think that paying attention to milestones matter. They're there, right? They're there for a reason. The child does need to go through the milestones. No matter what anybody says, they can't skip over them. They can't miss them. If they do, there's a problem. But the good news is you can intervene at any time and get the child back off track. So a child goes off track. It doesn't mean that they have to stay on track for the rest of their life, although they may, and it will affect them even into adulthood, or they can see someone like us who really knows how to put them back on track, and then they have a great life. And most of the kids, as I say, that end up with these imbalances are really actually gifted in certain areas of their brain that are naturally stronger, and that's part of the issue.
Absolutely. What about this? A big question that I get too is premature babies. So when do you go off the milestone development? When a kid is their natural birth? Is it whenever that they should actually, when the due date was?
Yeah, basically when the due date was. So you go from the due date. So if a baby was a month early, you would expect them to walk at 13 months, not 12 months, okay? And, we give a little bit of flexibility. Obviously, we know that children that are premature tend to have more, learning disabilities and behavioral issues, and they may be more delayed in their milestones because, if there's anything that alters the normal process of birth, or if it's more stressful than it should be, or a baby is born too early, again, all of these stages matter. And we know that even This study's showing even if a baby walks a month late, meaning instead of 12 months, they walk at 13 months. They followed these kids out till they were 35 years old and looked at their executive functions and whether they had any history of psychosis. And what they found was that just 1 month made a huge difference in their executive function in their frontal lobe when they were 35, and they were much greater risk for things like psychosis, schizophrenia. So these are big deals. So, people are told that from 11 to 16 months is normal walking age. My experience is no. I mean, a child should walk really exactly at 12 months. I give them, let's say, from 11 months till the end of 13 months to right before 14 months, where they can be considered within a normal range. So I give them like a 2-month range, maybe a 2.5-month range. But anything beyond that or anything before that, a baby walks at 10 months, that's too early. That means they didn't crawl enough. They walk late, 14 months or beyond, they're late, and there's a reason for it. It shows that there's something going on, and that child is almost always going to show up with some sort of behavioral issue, but they're probably also gifted in other areas, so it may be compensated for.
Absolutely. What about crawling? So, I worked with a kid this week, earlier Monday, and the mom was complaining, or she was talking about, hey, my kid, when he crawls, he drags one leg behind. And, she brought him to the doctor. The doctor told him that, kids just crawl differently. What's your opinion on that?
Yeah. No, crawling is a very important thing. And essentially what we're seeing is they're going through stages. Our brain has within it basically every brain that's ever been on the planet, right? So we literally go through stages of different levels of our brain. And it's like building a building. It's like saying, I'm here in New York City in a 16-floor building. And it's like the builder, when he's building the building, go, hey, we didn't really finish the 3rd floor and it's not really supported, but it doesn't matter. We're just going to keep on going and don't worry about it, right? I mean, that would be ridiculous. We're building the foundation of the brain, and what's happening in the developmental brain and in the child, especially in the first year, is really the foundation of what's going to be the adult brain. So we're looking at, the foundation of an adult. And so, crawling is very important, and it really needs to be done very specifically. They need to usually crawl on their belly for a little while. Right around 6 months, they should start. 7 months, they might be crawling on their belly, and then around 8 months or so, they should get up on their hands and knees, and they should crawl in a normal cross-crawl pattern. And then at around 10, 11 months, they should start getting up and walking and what we call cruising around the furniture and transitioning from walking to crawling. And then at around 12 months, they should walk independently on their own. Doesn't mean great, they're going to fall down, but they take their first steps, and that's normal. And if a child is dragging the leg, that is almost always an example of a retained asymmetric tonic neck reflex. When a baby turns the head, or if a parent turns the baby's head, one leg will extend and the other arm will extend on that side, and then the other leg and arm flex. And so that's the normal reaction. So when one arm is stuck in an extended position, it's usually because the asymmetric tonic neck reflex is still present in that side, and it may not be present on the other side. And that when there is not only a retained primitive reflex, which is, a sign that there's a delay in the brain, but when there's an asymmetric retained reflex, meaning it's retained on one side of the body and not the other, that is absolutely a 100% sign that there's a developmental imbalance in the brain. And that needs to be dealt with, because that is the basis of really all of these developmental issues that we talk about.
Perfect. Another question here. Is there kind of a 2-question, is there a common correlation with eczema and C-section babies, and what can be another contributing factor to eczema in an early infant?
Yeah, eczema is a big deal. It's one of the first questions I ask parents when I see them. I ask about, the pregnancy and the birth process. Was it a normal birth process? Was it stressful? Was there a C-section? And then I usually ask them, was the baby able to latch on? And then, when was dairy introduced, and was there any eczema at that time? So what we see is that again, when there's a developmental imbalance, we have to remember that the brain regulates everything. And the brain is the master regulator of the immune system, of the autonomic system, meaning our digestive system. And so everything is regulated by the brain. And that starts very early on. So when the brain is regulating the immune system, the left side of the immune system activates the immune system. I've put up a couple of papers on Instagram the last few days talking about this and showing the research that is really pretty deep over the past 30 years. And the right brain dampens the immune system and suppresses the immune system from being overactive, and it helps the immune system to differentiate between our body and other people's body. What is eczema? Eczema is an autoimmune disease. It's an autoimmune disorder where our immune system is overactive and it is mistaking skin cells for antigens, meaning for viruses or bacteria, because the amino acid sequence in something, maybe it's a food like gluten or casein, most commonly casein or dairy, their amino acid sequences that aren't fully digested in the stomach look like amino acid sequences exactly in the skin cells. And so the immune system, it not only attacks the gluten amino acid or the dairy amino acid, which it shouldn't if it's completely digested, because we shouldn't have long chains of amino acids. We should be digesting them, but we're not digesting them because the brain is not regulating the digestive system, because we have too much of a fight or flight system, and we're not developing what we call our parasympathetic system. So our digestive system, we end up with a leaky gut. We're not breaking down. We're not producing enzymes and acids. We don't break down the food and the protein like casein. We have longer chain amino acids that get into our bloodstream, and then the immune system sees it, and now it's overactive, especially if the left brain is high and the right brain is delayed, and we get an overactivation where now the immune system attacks the dairy molecule, which creates inflammation, but then the skin cells look just like it and they attack that. So the dairy triggers the attack on the skin, but the reason why we're getting the attack on both is because we have an imbalance in the brain. Usually we see this when there's a right brain delay, as in ADHD or OCD or autism or tic disorders or things like that, more behavioral issues. So what we see is that because the brain and the right brain is delayed, the left brain is overactive, and the sympathetic nervous system, which is what the fight or flight nervous system, which should be starting to be dampened as the brain grows and develops in the first few months, should dampen that sympathetic nervous system and promote digestion. All of that is not happening because the brain is immature. This goes together with the fact that, the baby may not be meeting milestones, and what we see is that early on, many of these children, because they don't have normal muscle tone in their mouth, in their face, which is related to the development of that parasympathetic system, they can't latch on. So a baby may have difficulty or not be able to latch on when they're breastfeeding, and they can't breastfeed in the first few days or months, or the mother may give up. And if that happens, then dairy formula is usually introduced very early. And I've seen kids with autism at 3 days getting eczema because they had dairy introduced. Also, as you said, with a C-section, a lot of that immune system in the baby is coming from the mother's vaginal secretions and from the mother's flora that should be ingested in the baby, which helps to build up the gut flora in the baby. And the mother provides the immune system initially through her breast milk. If the baby's not getting any of that because they had a C-section, then they're even more vulnerable. And so, these are all things that are at risk. And also because the mother has a C-section, many times she's under anesthesia. And so therefore, she may be recovering, so she can't breastfeed for the first few days. So they introduce dairy. And most parents don't even know this because they think, okay, my child was exclusively breastfed. The other thing is that if the mother is drinking milk or eating dairy, that can trigger eczema in the child. But if the eczema is being triggered in a child, it's always because there's an imbalance in their immune system and there's an imbalance in their brain that's already there.
Yeah, perfect. I'll just add, so there is, moms that are listening to, if you have to have C-sections, they do have what's called the gauze technique that they use. And what they do before you deliver, they take a gauze pad and they swipe. And when the baby's born, they'll wipe it over the orifice to try to help cultivate the lactobacillus. And then also too, for moms that were breastfeeding, their babies have, eczema, that I found sometimes that having the mom, taking digestive enzymes when she's eating certain meals, that also can help out with, the baby's eczema. But again, like you said, it all starts with these kids. They're having these imbalances from birth. And, it's just throughout their life, they're eating things that they're not breaking down because they, have developmental issues. So yeah, it was a great explanation. Another thing here is the question that I had was anxiety. So 2 weeks ago, I had a little girl that came in my office, really, really bad anxiety. If you walked up behind her, she just completely gets startled really easy. And these kids eventually will start having digestive issues and possibly even eczema because they're not breaking their food down. Can you just talk about anxiety? Because what I see with these little kids is these kids are coming in with anxiety and they're on 4 or 5 different medications. And again, what do you think is going on?
Well, again, we're projecting psychological issues or psychiatric problems on small children. And you very rarely actually see that, when they've been raised in a good family and in a positive environment. So what we're looking at is a neurological imbalance. Anxiety is an emotion that is generated in the brain. It has a reason, right? Basically, anxiety is the anticipation of a potential negative event, right? So we're worried about something negative that's going to happen in the future. Our left brain generates projected models of future actions and behaviors, right? And so one of the things that we see is that we can have overactivity in certain networks in the brain that are doing that are projecting into the future. And it's not that it's real, it's just that that area of the brain is overactive. If we took an electrode and we went into somebody's brain and we touched a specific area of the brain, we would cause them to have anxiety. For no reason, right? Just because we activated that area of the brain. If we went and we inhibited an area on the other side of the brain, we could cause anxiety to come out, right? So there's this balance going on, and they're emotions. Each emotion is regulated by a specific network in the brain. And again, a balance, there's some networks that activate those emotions or accentuate them or, make them stronger. And there's others that will dampen them. And so when we see immaturity of certain networks, especially the right side of the brain, which dampens a lot of things or stops things. And as you mentioned, that many of these reflexes, many of the primitive reflexes are there to initially kind of develop many of these networks when we don't have them. The brain needs to be calibrated when we're born, right? So we're born with these different actions and networks in our brain, and our brain is active from the beginning. It's not just a blank slate, but we have all this activity, and since we have no experience, the baby has no experience, we don't know what it means. Once we start activating it and interacting with our world and actively sensing things, we start to make sense of our world, and our brain and these networks start to be calibrated to the outside world. And that's what a lot of primitive reflexes are there. They help us to move when we don't have a brain to move us. And it helps us to actively use our senses so that we can calibrate ourselves and give ourselves experience, which now the brain can use and can compare it to what's already going on inside the head, and we can match them up. Once we've calibrated it, we can get rid of these reflexes and we can move on, right? But sometimes they persist. And and the same thing, the emotional networks need to be calibrated. We have anxiety, we have fear. A baby doesn't know why they would be fearful. A baby doesn't know why they would be happy. they just know they have these networks in the brain that can be triggered, but they have to match it to an experience in the environment. You understand? So what we see is that the Moreau reflex is what we call a startle response. So the baby will startle, will jump. And initially it's just a reflex, but it can be triggered by a loud noise. It can be triggered if they're falling. It can be triggered by fast movement. And it's a natural response that the baby's born with. But that forms the basis of an adult startle response, which happens, in response to something that really is fearful. We're really falling or something is coming at us. And we should be able to control that. So what we see is that a lot of these emotional states that we're seeing in babies are just things aren't being dampened and expressed the way they should be. They're not psychological issues. And again, trying to deal with them psychologically, what are you going to do? Do talk therapy with a 3-year-old, right? It doesn't work. So what you need to do is you need to understand these are neurological issues. You need to get rid of the primitive reflexes first, and you need to see if there is an imbalance, and you need to activate that underactive areas of the brain. If you don't do that, nothing is going to happen.
Perfect. Well, I'll just do a couple more questions here so I can let you go get back to work. Big question here is picky eaters. All right. So, a lot of parents have kids that are picky eaters. They say my kids, all I want to eat is carbohydrates, pasta, pizza, chicken nuggets, French fries, potato chips. They don't want to eat anything healthy. What can a parent do?
Well, there's two things with that, and I'll try to keep it short. One is that, again, when we don't have good digestive system, when we have an overactive immune system, those two situations lead to a potential food intolerance, right, or hypersensitivity to certain foods. But we also know that the right brain regulates smell and taste, and there's an area of the brain that also regulates our social development that is related to the development of smell and taste. We also know there's specific networks in the brain in an area called the basal ganglia that regulates food behavior. And so what we see is that if those areas aren't really developed appropriately, we find that most children that are extremely picky eaters, they don't have a normal sense of smell. Many autistic kids don't even know how to sniff, which should be a natural thing that everybody does. And so many of these kids don't even sniff. They don't smell things. We test smell on every child, and we see that it's almost always abnormal or deficient. And that area of the brain that regulates their social development is also abnormal. And this can lead to impulsivity and hyperactivity. And we see that, I tell parents, how do animals socialize? They socialize through smell, right? So the basis of our social networks is built on smell. And so all of that comes together to affect the behavior of a child so that they're not really driven to eat foods. They're very particular. They don't judge it by smell and taste. They judge it by how it looks or how it feels in their mouth or the temperature. And the other thing is that they, because they develop food sensitivities, the most common food sensitivities are gluten from wheat type products or dairy. And so children get addicted to those foods and they eat them in every combination, right? So bagel and cream cheese, macaroni and cheese, butter on bread, or, cereal with milk or pizza. And that's all they want to eat. And they just have these, just gluten and dairy, and they have it in every combination, and they want it for every meal. And they're literally addicted to it because gluten and dairy, when they're not digested appropriately, produce what's called glutamorphine and casomorphine. They're literally morphine opiate chemicals. And, we have very powerful receptors in our brain for opiate chemicals. And that's why opiates are so addictive. And so literally the kid becomes physically addicted to these foods. And so the combination of, not really having normal drives for food and then being addicted to certain foods, it leads to this really negative or difficult food behavior. And again, trying to break that behaviorally, trying to force a child to eat something or depriving them of a food that they're addicted to is very difficult and really usually horrific. And the only way to change that is to change the brain and to get their sense of smell to work, get their digestive system to work. And I go through this in my fourth book that I did with Zach Brown on Disconnected Kid diet and nutrition plan. We talk about problem feeders and, really difficult feeders and, how that relates and what to do about it. But it's a really difficult thing for families, and especially if you have to have an elimination diet for a while, because those foods are triggering immune. So this is where they really need to be supervised. They should be supervised by a professional who's trained when they're doing this, and need to really stimulate that brain. Otherwise, it's going to be a nightmare.
Absolutely. Last two questions here, because I know you got to go. One, we have people from all over the world watching this, but what kind of books would you recommend reading? And the other thing is for professionals, is there any courses that they can take to learn all this information?
Yeah, I don't want to sound too biased here. You can jump in on this as well, Kyle.
Yeah.
But I feel like for parents, if they're really interested in this stuff, this is the reason why I wrote my book. So Disconnected Kids is now translated into, I think, 10 or 11 or 12 languages. Just came out in Spanish. It's coming out in Turkish. It just came out in Japanese. And I think Disconnected Kids, Reconnected Kids, and the diet and nutrition plan are great for parents. People that, are thinking about getting pregnant and are concerned about it, are there ways they can lower their risk of having a child with a disability? That was my third book, Autism, the Scientific Truth. It's not just about autism. It's about how to potentially lower your risk for any child with a disability. And then, those books, I think. And then for professionals, we have my online course. We have the course that we're teaching in Atlanta that is, postponed in July, that will pick up back in May, hopefully. But it is recorded, and it is also going to be available online. I'm also teaching it in Bulgaria for people in other parts of the world, or in Europe. I'm teaching in Sofia, and we do that once every other month or so. And it's a great venue to see the course. And as you know, I have great people like you and Brandon Crawford and Peter Schreier, and we have, some of the best minds and people with the most clinical experience. And we're talking about cutting edge tools like the NeuroSage and like lasers, and how to be able to use them, and giving people specific protocols that they won't get anywhere. So, I think those are the best options right now for people if they really want to learn this stuff.
Yeah, absolutely. So as you can see, most of you guys that have listened in on this, it was pretty targeted information, which is a lot, jam-packed with a bunch of great, info. My Instagram page has, recommended books to read. There's also, different examples of primitive reflexes and just some research papers, just like Dr. Melillo. So if you don't follow Dr. Melillo, I encourage you. But yeah, all his information, it's been life-changing for my private practice. Earlier on, I was just checking primitive reflexes in kids, and, I was working with brain injuries, and, I was doing, eye movements and different type of vestibular stimulation, and, but I wasn't checking for primitive reflexes in adults. And, I'm seeing this stuff now after working with you, Dr. Rob. I'm seeing, adult people in their 60s that have retained primitive reflexes, and now they're starting to have cognitive issues. And, it's incredible now, because if you don't ever check for it, you don't know it's there. You don't know that you can do certain treatments to help out with, integrating these reflexes to start improving people's, overall brain health.
And
so
you're exactly right. As we said, when you're looking at right now with this whole coronavirus thing, people don't realize that, there are no medications right now that really we know that are effective for it. The only thing you can do is prevent it and keep your body as healthy as possible and boost your own immune response. The brain regulates your immune system, and the left brain in particular. So I've been talking about a lot about doing things for your left brain, and even elderly people, they can have primitive reflexes. And the first thing you need to do is get rid of those reflexes. And you can do that. If you do that, you're gonna help them, or may be able to help prevent their illness. But stimulating the left brain, things like, using the color red, having red around you, or red glasses, listening to music, happy music, doing positive motivational things, writing, doing things like, math, or playing certain games like word games, or doing things like puzzles. These are all things. And reading is one of the best things you can do for the left brain. And with that, I just want to throw a little bit of a plug in for, if you're home with your kids or by yourself and you have some time, I just came out with a new novel. It's my first novel. It's a historical fiction called Einstein's Desk, but it also is educational. It's in an entertaining way. We're educating people about the brain and about the principles of functional neurology. A functional neurologist is one of the main heroes of this book. And it starts off with a kid who really is labeled with autism and has a disability. And it talks about other great people throughout history like Einstein and Nikola Tesla that probably also had certain disabilities and imbalances, but were geniuses. So it's a really entertaining book, and it kind of is an educational book, but it's also really kind of fascinating and fun. And that's a great way to stimulate this time and also educate yourself more about what's going on. And even teenagers can read this book. So.
Awesome. Yeah, I just got mine in the mail last week. So, well, Dr. Rob, I appreciate your time, man, and look forward to seeing you here in a couple of weeks.
Well, thanks, Kyle. Thanks for doing this. Really helpful. You're always on the cutting edge. You're my young star that's doing the technology. Without you, I wouldn't know how to do this.
So,
all right, man.
Have a good one.
Thank you. Good luck, everybody. Stay safe. Bye.
Bye.